Well, practice has officially started for high school sports teams, and with many kids returning to sports after some time, there is a risk for injury.
I know, it's always so scary. Dr. Matthew Hall is joining us now. He's the co-director of the Institute for Sports Medicine at UConn Health. Hello, doctor.
Hello, thanks for having me.
Oh, our pleasure. You know, if I don't have children, Doc, but if I did, I'd put them in a room and they'd never be able to come out because I'm afraid of injuries.
Sure.
But you guys can definitely help, right?
Yeah, we can help with that for sure.
My mom used to give me bacitracin and a Band-Aid and say, go back out. It's time to go back out. But anyway, so listen, there are...
Well, it's exciting that we're even having this discussion, that we're getting out there and getting ready to play.
Yeah, absolutely.
Absolutely. So listen, we are getting out there and the kids are going to be able to play. Is it different rules with different sports, or do you see some of the same injuries with kind of all of them?
Yeah, for sure. There's definitely you'll see a shift in injuries depending on, what sports you take care of or you might be responsible for. Like, for instance, for me, I help take care of men's soccer and field hockey in the fall. And so if you look at soccer, you're going to see, concussions, you're going to see quad muscle, hamstring muscle injuries, ankle sprains, and then something like field hockey, you're going to see a little bit more lacerations, cuts that might need stitches, hand and finger fractures, just because of the nature of their sport.
What specifically is the Institute for Sports Medicine? It's a specialized place at UConn, right?
Yeah, the Institute is really, I think, a way of trying to bring together a lot of parts that are already at the University of Connecticut, people through UConn Health, specifically within the orthopedic department, sports medicine providers, orthopedists, family docs that do sports medicine, and then our kinesiology department, physical therapists, athletic trainers, people that provide clinical care, but also do a lot of research and kind of bring that power all together, try to help sports organizations and teams with the care of their athletes.
What do you recommend for parents and even schools and coaches to have readily available for kids, depending on which sport they play? Like, what do they need to keep themselves safe?
Well, I think, one thing for sure is, having a good athletic training staff. If your school has an athletic trainer, it's a great resource. If they don't, I think that would be something that I would push for as a parent for my school, administration, because they can provide a lot of care. They can do assessments. They can help do some prevention, things like treatments and rehab, and also make sure that athletes get seen if they have something that needs to see a provider or a physician.
What about COVID? I know it's still a major concern. Do you have any advice on how to protect themselves from COVID?
Well, I mean, number one, if your child is eligible, going back to sports, I think vaccination is our best way. And
right.
If you have questions about vaccination and concerns about that, talk to your medical provider or get facts from good resources like the Department of Public Health. And then just following, guidelines that are available. If your child isn't, you yourself consider getting vaccinated, and that's our best chance to keep our kids out there participating and doing the things that we like to see them doing.
And doctor, when you're seeing a kid in your office and they're getting ready for recovery, what kind of advice do you give them? Stretching, take time, and then I'm sure at some point in time you've had to give some heartbreaking news like you're out for this season. So how do you handle the aftercare?
Yeah, I think, certainly it's a little different if they have like a traumatic injury, these things that just happen as part of sports. They fall, they have a fracture that, you just try to give them a little bit of pep talk and that this is going to heal and you'll be okay. For those that had something that maybe from a training error or happened over time because they were maybe doing too much or participating in the wrong way, we try to fix those things so that they don't come back to the office, keep them away from us, and keep them on the field.
And how do you know whether or not it's important enough to go to the Institute for Sports Medicine? How do you know if the injury is serious enough?
Well, I think, again, separate it. So if you're, out playing, you twist your knee or you injure something and you feel something that doesn't feel right, the joint that is swollen or your leg is swollen, you're having difficulty using part of your body, that would prompt somebody to be seen, within the next couple of days for sure. And then anything that just kind of starts bothering you, kind of pops up, if it lingers for a week or so, it is really not getting better, I would suggest giving your provider a call and getting that checked out.
Excellent.
We have to wrap, but concussion's always a big concern, and you do recommend baseline concussion testing?
Yeah, baseline concussion testing can be, helpful, and it's something that you can always compare your assessment to when you see them in the office. So it definitely can be a benefit in the care of concussions.
All right, thank you, Dr. Hall. We appreciate your time.
Thank you so much.
All right, thanks for watching Better Connecticut. That wraps up this season,
Yay!
season 14. We'll see you back in September. Thanks,
Have a
Renee.
great weekend. Bye.
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 Peace
Bye.
out.
Thanks for watching Channel 3 Eyewitness News. Watch us live wherever you are on our mobile, on our streaming news app. And you can also watch us on Roku, Apple TV, and Fire TV.